name is Anya Barnett. I am the program director for Safe Streets Wichita, and my colleagues and I, Nak Vong and Jan Chandler, are here to discuss with you advocacy at the crossroads of harm reduction and social justice in Kansas.
Safe Streets Wichita is a substance use prevention coalition sponsored by Partners for Wichita Incorporated. The mission of Safe Streets Wichita is the prevention of substance-related harms through community collaboration, the advancement of health equity, and the promotion of mental wellness and community well-being. Safe Streets, diversity is key. We acknowledge that every community experiences substance-related harms. Some communities experience a proportionate amount of harm. Our strategies center those impacted and systemically underserved due to poverty, class, racism, social isolation, past trauma, sexual orientation, gender identity, and other social inequities, which affects people's vulnerabilities and capacity to effectively deal with substance-related harm. We focus on addressing disparities and promoting prevention for youth and equity for all with lived experiences. Our coalition uses a strategic prevention framework to help improve the well-being for Kansas communities. Substance use not only affects adults, it also affects young people. The youth mobilizers at Safe Streets Wichita are motivated and committed to increasing community awareness about prevention efforts to reduce underage substance use, mental health promotion, and social determinants of health programs. Prevention reduces risk factors and increases protective factors. At Safe Streets, prevention is what we do. Safe Streets Wichita is a substance use prevention coalition.
Thank you, Jan, for the video. So we're going to start off with a nationwide story of the drug epidemic. In 2021, it was reported that there were more than 100,000 drug overdose deaths. This is the highest number ever recorded in a single year. Most of the drug overdose deaths in the United States were attributed to lethal concentrations of synthetic opioids, such as fentanyl. But we want to take a closer look at what's happening here in Kansas. And so with the Kansas story, from June 2020 to June 2021, there's a percentage increase of drug overdose deaths of 44.7%. Get this, we were the third highest state with drug overdose deaths in terms of percentages, third only to Vermont and Mississippi. But we want to take an even closer look, and this is where Anya will share with you the racial inequities within the drug overdose crisis in the United States.
Thank you, Nak. Since 2015, the death rate among Black men has more than tripled, rising 213%, while the rates among men, white men and while the rates among men in every other major racial or ethnic group have increased at a slower pace. The overdose fatality rate among Black women rose 144% between 2015 and 2020, far outpacing the percentage increases among women in every other racial or ethnic group during the same period. 90.48% for Native American women, 34.8% for white women, 70.45% for Hispanic women, and 80% for Asian Pacific Islander women. When we look at the data, and the messaging, we want to know who and what are at the center of the narrative. What are the stories and the experiences of substance use that are being amplified, and how are we truly seeing these messages? How are we truly seeing the folks who are placed at risk? To ensure our prevention efforts are truly inclusive, We created the diversity statement that you heard in the intro with Jan, that's embedded into the mission of our organization. Also, certain people have been left out of the conversation. So we are trying to do our part to center those voices. Here's a video for one of our coalition members who's boots on the ground on the front lines of addressing overdose deaths in our communities.
My name is Angela Scott, and the work that Safe Streets does is important to me because substance misuse and use has effects and impacts on our communities and families that is generational. And with the work that Safe Streets is involved in, advocates for, and tries to bring awareness to, can do much, much good in the community, particularly the communities that I represent, who see the impacts of drug abuse, of drug policy, of lack of resource to deal with some of the health and mental health things going on. Safe Streets is really a resource for me, something that I can share with communities and that I'm just so glad to be a part of. My name is Angela Scott, and the work.
The social determinants of health are conditions in which the places where people live, work, and play impact the wide range of their risks and their outcomes. Racial biases are inescapable foundations of how drugs and drug use are viewed in the United States. And we know that this increases risk factors, yet it has been the persistent cornerstone of public health, public policy, and education. And while harm reduction is not a new modality to prevention and addiction science, it creates dialogue and advocates for policy that centers racial equity, creates dialogue, and advocates for that within our prevention frameworks. What is harm reduction? Harm reduction was established in the 1980s as a public health strategy for people dealing with substance use who may not be able to do it by abstinence alone. These principles do not give or do not ignore or condemn any behaviors, but we do use this to minimize the effects, the harmful effects, and work towards breaking the stigma. Some of the principles of harm reduction you will hear people say is meeting people where they are. It's a commitment to evidence. It is also a commitment to social justice and collaborating with networks. And it's, like I said, again, the avoidance of stigma. If you can think about it in your own life based on this harm reduction, what does harm reduction look like in your world? What are some examples of harm reduction? And you can just put that in the chat and we will mention some of your answers. Helmets while riding bikes, yes. Prophylactics, contraceptives, seatbelts. Exactly. So we're familiar with the harm reduction concepts. Back to you, Nak.
And so based on the principles, the framework of harm reduction, last year, our team over at Safe Streets, we wrote a report, a literature review essentially on different strategies that we want to take back to Kansas, different strategies that we want policymakers, we want communities in Kansas to consider with respect to two main objectives. How it is that we can effectively prevent overdoses and overdose deaths in Kansas, and two, how it is we can increase access to care for people with substance use disorders in our state. And so based on a very broad, very in-depth literature review, based on a very thorough review of what other states were doing with respect to the drug overdose crisis, what other countries were doing with respect to the drug overdose crisis, we found 5 strategies that we're recommending for the state of Kansas. And I'm just going to go ahead and list them off here, but you'll hear more about them later on in this presentation. The first one increased access to and utilization of naloxone. 2, medication-assisted treatment or medications for opioid use disorder, especially in criminal justice settings, and especially as an alternative to incarceration. 3, fentanyl contamination testing. 4, certain services programs. And 5, 911 Good Samaritan laws, otherwise known as GSLs. And so we're going to take a look at this first strategy that we identified here. How it is that we can increase access to naloxone, otherwise known by its trade name, its brand name as Narcan. So naloxone is an FDA-approved medication that helps reverse opioid overdoses. Moreover, it has little potential for misuse and dependency. But despite passage of a statewide naloxone protocol to encourage naloxone use in 2017, it still remains underutilized. As a frame of reference, according to the Board of Pharmacy, just 1 in 4 Kansas pharmacists have signed the statewide naloxone protocol. Moreover, nationwide right now, there is a shortage of naloxone. And so our recommendation then is we want to facilitate education / training, ensure affordable access, and help provide information on how it is to administer naloxone. And the next slide here, I have a question for you. And again, you might not know it. That's completely all right. But if you have suggestions, we'd love to hear them. What are your recommendations to increase accessibility and utilization of naloxone in the state of Kansas? And so these were the kind of questions that we were asking ourselves as we wrote this report. And here are some of the answers, some of the suggestions we came up with. Increase the number of pharmacists enrolled in the statewide naloxone protocol. Encourage healthcare professionals to discuss and prescribe naloxone for patients that are at heightened risk for an opioid overdose. Prioritize community-based naloxone distribution. Organizations such as DECA already do a lot of phenomenal work with respect to providing naloxone for those that are at risk for an opioid overdose. The question then, how can we encourage other community organizations? And not just community organizations, but grassroots groups, libraries, social services in general, to take part in this effort. We also want to fund and equip first responders with naloxone, with a caveat that these are based on the most efficient response times. So in other words, say if for a certain town, certain city, or certain county, the firefighters have a quicker response time than EMS, or in another county, the law enforcement has a quicker response time than EMS or firefighters. We definitely want to take that into consideration. And finally, we want to encourage people to participate in naloxone administration training. Once again, DECA, they're a phenomenal resource for training of this sort. So there is an incredible, I don't say that in a good way, a crossover between individuals with substance use disorders and individuals who are incarcerated when they should not be, when they should be in treatment, when they should have access to recovery resources instead. And so while the numbers do vary based on this kind of studies you look at, it is estimated that more than half of incarcerated individuals do meet the criteria for substance use disorder. This was based on a report from the Kansas Department of Corrections, but it's estimated that 75% of individuals released from prison in Kansas need treatment and recovery programming. Just half of those individuals have that need met. And so when it comes to treatment itself for opioid use disorder, from the research side of things, one of the most promising developments has been medications for opioid use disorder, also known as medication-assisted treatment, more simply put, MAT. MAT entails the utilization of FDA-approved medications, such as methadone, buprenorphine, naltrexone, and then you also have combinations of those, such as Suboxone. This is in conjunction with psychotherapy. And so there is very strong empirical support for medication-assisted treatment in terms of treating opioid use disorder, helping prevent overdoses, helping prevent relapse, helping prevent recidivism. However, most states, including the state of Kansas, significantly limit MAT, or they do not offer it in their correctional facilities. Generally, it's only limited to pregnant women for a very limited amount of time. But I know that on several counties have been taking a more proactive approach in terms of how it is they can increase access to MAT within their facilities. So our recommendation then, we want to ensure access, the provision of MAT programs in correctional facilities and after release. Above all, we want to emphasize access to treatment as an alternative to incarceration. And so once again, what are your recommendations to increase access to MAT for incarcerated, formerly incarcerated individuals and in general? Or in another note, what are your recommendations to increase access to care for individuals with substance use disorders in general? And so once again, these were some of the answers that we found. Some of these are already taking place. They could definitely use a lot more institutional support though. Others could use a lot of work right here in our own communities. Things like drug and mental health courts, ensuring that there's adequate health insurance coverage for MAT, law enforcement assisted diversion programs. For some context on what LEAD programs are, it's up to law enforcement officers' discretion, but instead of entering the criminal justice system, individuals with a substance use disorder can enter a trauma-informed intensive care management program that provides a wide range of social services, from housing, employment opportunities, education, to substance use disorder treatment. So once again, emphasizing that alternative to incarceration for people with substance use disorders. We want to convene stakeholders from all walks of life, whether it's healthcare, whether it's those and the criminal justice settings, whether it is people with lived experiences, those in recovery, those that have been incarcerated themselves, and to both mitigate the barriers to MAT and also strengthen the facilitators to MAT within these settings. And finally, we want to reduce restrictions to be an MAT provider. So with respect to fentanyl contamination testing, fentanyl test strips, they could be a major game changer, in my opinion, for the state of Kansas. They're very affordable, I'd say, almost like $1 a strip. And these strips, they help prevent opioid overdoses by informing individuals who do use drugs, whether the drugs they're using contain fentanyl, empowering them with that choice of should I use alone, or should there be a couple other folks with me? Should I have naloxone on hand with me, or should I use a different batch of drugs altogether? And so in other states, FTS programs have been very effective in terms of helping mitigate, I'd say, health risk behaviors. Once again, ensuring that there's naloxone at hand, finding using drugs that don't have fentanyl, and then things of that sort of nature. However, FTS currently considered drug paraphernalia under state law. In the last legislative session, there was a proposed amendment introduced, Kansas House Bill 2277, which would have excluded fentanyl testing strips from the definition of drug paraphernalia. It did pass, to my understanding, the House committee. The question now is whether it's introduced to the Senate Judiciary Committee. And so our recommendation, we want to allow and facilitate the provision of FTS utilization in programs. And so more specifically, Kansas House Bill 2277 would revise, would clarify the definition of possession in the Kansas Criminal Code. So this would revise the definitions of drug paraphernalia and unlawful possession of certain drug precursors and drug paraphernalia. But in tandem with our efforts for fentanyl test strips, we also want to encourage participation in what is called the Overdose Detection Mapping Application Program, also known as ODMAP. So ODMAP, it provides near real-world time data on suspected overdoses. And let's see, you click the link here. But there are, in the state of Kansas, there are a handful of counties, first responders that have signed up to take part in the ODMAP. Ideally, though, we would love to see this be a statewide initiative, and, and to be more specific, to ensure that each and every county in the state of Kansas does take part in this program, because having this information would help us better anticipate, better prepare, better prevent, better address substance-related harms in general, especially overdoses. And of course, go ahead, Anja. Sorry about that. So the drug overdose crisis is essentially a syndemic, and that you have various separate crises that are occurring simultaneously. In this context, there is a significant relationship between opioid overdoses and the spread of bloodborne infectious diseases such as HIV and HCV. So in this regard, what many other states have done is that they've implemented what are called certain services programs. SSPs, they help ensure safe usage, safe disposal of injected drugs, and equally important, they link people who use drugs to substance use treatment, who otherwise normally wouldn't request treatment at all due to that stigma. And so once again, it goes back to that principle of harm reduction in terms of meeting people where they're at, and how it is that we can make access to care more accessible. Contrary to misconceptions, SSPs do not increase illicit substance use. They do not increase crime. They do not lead to discarded needles in public locations. And so looking at this map here, in the dark blue, you can probably guess by now, the dark blue are the states that have that do allow for SSPs. The states in light blue are states that have not allowed for SSPs. And so the same laws that prevent utilization of FPS also prevents access to SSPs. And so in this regard, our recommendation based on the evidence is that we want to allow and facilitate the provision of comprehensive SSPs to improve treatment outcomes, reduce opioid overdoses, and reduce the transmission of infection. And so again, question for you all. We'd love to hear your ideas. What are your recommendations to increase access to SSPs? And so from a policy level, what has to change are the Kansas statutes themselves, those that constitute unlawful possession of drugs and drug paraphernalia, those that constitute unlawful distribution of drugs and drug paraphernalia. But we also want to consider what have other states, what have other countries done with certain services programs that has worked well, that has not worked so well, things that we can take back to Kansas for best practices on the implementation of a pilot program. And again, this probably will be more so a long-term policy agenda. I would love to see a pilot program though for a certain service program in a rural community and then an urban community. And then to see what effects that has in terms of reducing opioid overdoses, increasing access to treatment, but also reducing HIV, hepatitis C infection. And so here's another question for you all in terms of what a safe injection kit would entail. Just from my perspective, things that would be included, when we ever get to that point of these harm reduction strategies being allowed in the state of Kansas. Things such as fentanyl test strips, sterile water, sterile needles, syringes, naloxone, but especially information on treatment options, information on recovery options. And then at our last bullet point here is that we want to ensure we want to advocate that KDHE and local health departments request a determination of need from the CDC for a certain service program. Next slide, please, Anya. And so this is our last strategy as of now for this presentation that we're looking at, that we're advocating for, a 911 Good Samaritan law. So the reason why many overdoses become fatal in the first place is there's a lot of fears, reasonably so, that calling 911, calling for help would lead to arrest, would lead to prosecution for affiliation with a drug-related crime. And so realizing this, many states, 48 jurisdictions, including DC, in fact, have passed good Samaritan laws that provide legal protections for those who do call for 911 in the event of an overdose, and ensure that people who have overdosed receive that emergency care. However, a lack of awareness of GSLs in these states does remain a barrier, but even then, GSLs have been associated with decreased opioid overdose deaths, and decreased overdose deaths in general. And so our recommendation then is to ensure a 911 Good Samaritan law, coupled with education efforts for first responders and community members, letting them know that, hey, this law is here. And more specifically, what this would entail will be a change to Kansas House Bill 2365, an act concerning crimes, punishment, and criminal procedure relating to controlled substances, immunity from prosecution for seeking medical assistance. And so I'm willing to bet you guys have heard enough of me today. So I'll just make this final recap here very quick before we pass things on to Jan again. But as a final recap, based on the literature, based on what other states, other countries are doing, and especially based on what has worked, we're recommending 5 harm reduction strategies for the state of Kansas. 1, naloxone. 2, MET. 3, fentanyl test strips. 4, certain services programs. And 5, the 911 Good Samaritan law. And so we have a couple of actionable steps for you. The most specific one we have for you right now is to send a letter to the Senate Judiciary Committee requesting a hearing on FTS. And Anya, she posted our templates of a letter that you can send to them on our exhibition website. We also want you to meet up with your elected officials and other community leaders to gather their thoughts on harm reduction and to share your stories, your lived experiences. I'm willing to bet that some of these strategies, and we already know this, some of these strategies are going to be a lot more controversial than others. There's going to be a lot of stigma attached to them. At the same time, all 5 of these strategies will be necessary if we want to save lives. We want to convene stakeholders to develop and implement a plan that strives for 3 goals. 1, mitigate substance-related harms, things such as overdoses, the spread of infectious diseases, underage substance use. 2, increases access to prevention, treatment, and recovery. And 3, above all, that these efforts are rooted in a framework that emphasizes harm reduction and health equity. And so with that, I'm going to go ahead and pass it on to Jan.
Oh, thank you both, Nak and Anya, for such a thorough report about harm reduction. With that, in closing, you'll see here on the screen, we have additional information we have links to the harm reduction and the prevention of opioid overdose deaths in Kansas. We also have a link to the Naloxone statewide dispensing protocol for pharmacists. So this information is available to you. And next we will have our next slide. Our next slide is just contact information for the Safe Streets staff. You see we have Nak Vong, Anya Barnett, and myself, Jan Chandler. And you can reach us on Facebook, Twitter, or Instagram. Thank you all so much. Have a great afternoon.
Wonderful. Thank you all for that presentation. We'll put some of this information in the Hoover. I don't know if there was any questions. I've seen some questions in the group. I see that Olivia talked about if there was a number in Wichita that people could call to intervene in a mental health or social service crisis instead of immediately calling the police, I believe is what she's saying, to avoid police interaction. I know my answer would be no, that they have created, in Wichita, they've created uh, a collaboration between officers and mental health professionals. And there is I believe it's a van kind of thing that they will dispatch out if the person who's calling is saying that someone is having some kind of mental health crisis. But of course, we know that they run on a schedule. So sometimes they may miss those opportunities to be able to really intervene in those situations.
Yeah, Olivia, that's a really good question. As far as I know, I think the answer is unfortunately also knowing that communities such as Sedgwick County do have a co-responder model. What Patricia was referring to, the integrated care team. So you have the mental health professionals such as a social worker, EMS, and then the law enforcement officer. But in terms of having law enforcement out of that equation altogether, I don't know if that is something that we have. Anya, do you kind of have a better sense of that? Or
I don't have a direct contact for that. That is not my information, but just to Google it. Not that it's not my information. That's not my area of expertise. So I don't want to give any wrong answers. Just a quick Google leads to the City of Wichita page that houses the integrated care team. However, I don't see a number or a way that you can directly call them. I will say in instances in which I've had to report a mental health episode. Last summer, my neighbor was having kind of a crisis in the middle of the street. And I immediately went to what the issue was. I just said, I have a neighbor who's having a mental crisis and we need help. There are no weapons. There were no weapons. There were children around. And so I made that distinction to the 911 operator so that when they did dispatch police, that they could potentially dispatch the care team if they were on call. But then also, I did not want them coming with guns blazing. There were children out there, and this was not an instance in which the person needed to be physically detained. They just needed help. So that's just that is not a professional advice that I'm giving. I'm just giving a personal experience. And it did help in the response. When the police came, they were more receptive. They were more willing to close off the area, safely get the person out of the street, and they responded well. So that's just my little bit of personal advice.
Now I could ask the question of the people who are participating about naloxone and ideas about how to get it out or where to put it. And so there was a comment in there that said something about using those, those break boxes that like you're supposed to break in case of an emergency boxes, maybe placing those inside of a club or in a hotel with that naloxone in there.
Yeah, I think they should be in first aid kits. They're small enough for them, and most places have them. You have to have them. I think a first aid kit would be a great place to store it.
Does it expire?
They do expire. However, because they've been in such high demand, I know there are some organizations, especially grassroots organizations, that still use them or still disseminate them. I'm not sure what the recommendation is as far as the expiration date, but I know that it still has some efficacy to it.
Is there, if you wanted to, okay, you can come in, but I was going to ask you, if you wanted to get naloxone, is there some kind of special training you have to have or special degree you got to have, or you have to work in a certain place to be able to get it, or can anybody get it?
I think the intent behind it is that to make sure it's as accessible as possible. So say, for example, a lot of the coalition members for Safe Streets Wichita, we recently, I wouldn't say recently, but at our annual retreat, we went through naloxone administration training ourselves, taught by DECA. And so definitely in terms of whether you have to have medical expertise, healthcare expertise, I don't think that's necessary, but at the same time, I think having that proper training and proper information on how it is to administer naloxone, I think that's very important. But yeah, Anya just put a link in the chat here on how to get a free naloxone kit.
Okay.
But yeah, the other caveat is that again, like there's a nationwide shortage. So there's that valid question then. And again, this is probably something more so on a national level. How it is we can encourage mass production of generic forms of naloxone, and that way you're essentially flooding the market from an economic standpoint. You're essentially flooding the market with naloxone that's a lot cheaper than what's typically provided for through Narcan. But yeah, hopefully that answered someone's question. I don't know where I was going with that. It's probably my own.
It's all right. We appreciate you sharing with us. Are there any other questions out there? If not, we're going to end our time on this afternoon.
I was curious, Patricia, I think you asked this question about using the fentanyl tester strips and how you use those with pills, if anyone has the answer to that.
Yeah, I asked the question, does it have to be dissolved? The pill have to be dissolved?
Yeah, so what you do is you essentially dissolve a very, very small amount of it in water. It's kind of like a pregnancy a test, so to speak. But yeah, if need be, we can provide you more information on how does like a fentanyl test strip works. I think that slide did have
it had a picture of it, yes.
Yeah, it had a tell for whether it contained fentanyl or not. The one line had fentanyl, the two lines did not. But
because I think about it, I think about how it has been going rampant, and I know some people who children, which I won't call them children, they're young adults that have died from just taking one pill. And so I don't know where what they would have been interested in dissolving that pill to find out if there was fentanyl in it, right?
Yeah, it's a little bit of you don't know, but then also that's not our job to attempt to hypothesize about that. I think it's a matter of making a resource that's available to prevent a death. And there has been a growing movement among people who are actively using drugs, that it is something that they're willing to try just because of the influx of the illicitly manufactured fentanyl on the street. So a little bit of appeal is worth whether you live or die. So yeah, like I said, harm reduction, we have no judgment in that. We just want to offer the resource.
I like that. I like that. I'm glad to hear that.
Well, thank you all. We put our coalition information on there and our Facebook and social media pages. Also, please visit our exhibitor booth. That's where we uploaded the templates for the letter to send to your legislator. If you are in Wichita and Sedgwick County, please join our meetings. If you're in Kansas, we are still virtual. Please join our meetings. Like I said, we want to center the people with lived experiences and the people most connected to them. So we need more boots on the ground. We need more grassroots activists out there. So please look into joining our coalition. We are here. And then also we'll hopefully be offering more naloxone trainings in the future as we get over this surge. And so if you're interested in that, following us will be a great way to stay in information with that.
Well, thank you, Safe Streets Wichita. And this is going to conclude our afternoon session. Have a great rest of the day.
Bye, thanks for having us.
Take care, y'all.